Hello, good day. My name is Angelica Pederi, grade 12 Ladja. Here are the risk factors in dancing. Previous history of injury, insufficient skills in coping with stress, low body mass index or BMI, and fat levels, risky movements and technique, and overtraining. Having a previous injury increases the risk of subsequent injury for dancers. So now, what are the chronic injuries? Chronic injury, which are also called overuse injuries, are health problems that can develop slowly and last a long time. If they are not treated promptly, they can cause a lifetime of pain, inflammation, and overall discomfort. Here are the examples of common chronic dance-related injuries. Type of injury: adolescent anterior knee pain. Cause: happens when your teen's kneecap is pulled out of its groove from increased pressure. Symptoms: dull, achy pain that begins gradually and frequently activity-related. Prevention: wearing appropriate shoes for your sporting activities, performing warm-up exercises before the physical activity. Acute injury is generally an injury that is severe and with sudden onset. Sprained ankles, strained backs, and fractured hands are acute injuries. Acute injury is a sudden injury that is usually associated with a traumatic event such as clashing into another player during sports or fall from a bike. Example of common acute dance-related injury. Type of injury: hip injuries or hip impingement. Cause: misshapen femoral head, deformed femoral neck, or a hip socket that covers too much of the femoral head. Symptoms: stiffness in the thigh, hip, or groin. The inability to flex the hip beyond a right angle. Prevention: rest, eyes, avoid a high-intensity exercise and movements requiring repeated hip flexion, twisting, and deep squatting to relieve symptoms of hip impingement. The purpose of this video is to understand what are the causes, effects, and prevention of chronic injuries, as well as its definition. Now that we're done, let's warm up first before doing the physical activities. Proper venue for the activity. Warm-up routines before doing the activity. Rehydrate by drinking enough water even when you're not thirsty. End the session with a cool down exercise to allow the body to back to its course.